All right.
I'm with my. Oh, wait,
Thank you.
what's that?
Hang on. Dr. Chen is joining us very soon.
The meeting will be recorded. Got it. Okay.
Hello.
Hi.
听得到吗？因为有耳机吗？
Mungkin tanah mo, agi mo. We will just fix that.
So Nazir, when we begin. 他们想投在电视上。
可以。
对，他们全家都在，全家都在。
Hi.
Hello.
Hi.
Nazir. Hello. So Nazir, when we begin, right, I will do some translation for Dr. Chen.
Okay.
Is that okay? All right.
Yeah, sure.
Okay. So you can begin when you are ready.
Hi, good afternoon.
Good afternoon. Good afternoon. 你能听得到吗？
听得到。
All right. So is that your sister?
Yes, she's also my sister, so that I will not forget our meeting. That some of the topics. Yeah, because I'm getting forgetful.
Understand. So maybe you can begin by starting.
Yeah, sure.
Roughly explaining your situation from the start, and then try to make it in small paragraphs so that I can break it down and translate as well.
Yeah. Should I start from my first
start from the very beginning.
Experience of pregnancy? It was 2015 when I first got pregnant.
2015, huh?
15, yeah.
Okay.
And then during the first trimester, there was a heartbeat, but then we lost it somehow during 13 or 15 weeks. I just forgot. I'm not sure with the two. 13 or 15. We lost the heartbeat.
Okay.
So of course the only way.
Hang on 所以他说他2015年第一次怀孕，然后呢，在第一个就前3个月了，本来是有胎心的，后来到第13、第15周没有胎心，流产了。那是他第一次的流产。对。Okay. Second pregnancy.
Second pregnancy, I got it full term, but then I was researching about my signs during that time. I actually almost lost it too, but then luckily or fortunately, I was able to drink a lot, as in a lot. That's why I also had a terrible feeling, just like the hyperemesis that you were telling me. But you said it's a simple or mild symptoms that time. But I didn't know about that at that time. I just found it like a few weeks ago. And then it was full term, but then
full term means how many weeks? How many weeks when you labor? Premature, right?
Oh, that is what I'm not sure of, but I think it was 37, 38, something like that. But it was at the 9 month. But during the 7 months, I also developed gestational diabetes.
Okay.
During the 7 months. Good thing we were able to recognize or diagnose that what do you call this, in a short period of time. I knew it right away that I had it, and then I changed my diet. I was supposed to transfer to another doctor, but then I did not go to that doctor. Instead, I chose the diet, and then good thing the sugar level was managed. Until then, I gave birth at 9 months. And then after that, another 2 years, another 8 months that I got pregnant, I gave birth, and then another 8 months, I conceived again.
This is the third pregnancy, yeah?
Yeah, the third
Okay,
pregnancy
hang on.
now.
The second pregnancy, I will explain to Dr. Chen first, okay?
Okay.
所以院长第二次她怀孕后，她当时不知道自己有妊娠剧吐，因为她看了我们的视频才知道哦，当时还有妊娠剧吐，因为她头昏脑胀啊，然后又吐胆汁，然后也是又很长期，然后呢，第二次怀孕是全程的，就是9个月生了，然后呢，
吐了几个月
？Neither during the second pregnancy, right? You were vomiting a lot, right?
Not
Vomiting
a
and
lot.
headache.
I was, headache.
她
With
说
the
好像眩晕
vomit,
症，
when I knew that
她
I'm
说感
on,
觉很像眩晕症，
it's
她一站起来就受不了。For how
acid.
long?
It's more of
did it last?
acid.
For how long did it last?
20 weeks.
对，20周，
Almost like that. 5 months.
接近5个
5
月
months.
就
？I
不断的。
see, I see.
5 months.
然后同时呢，她也有这个妊娠糖尿病，她说，他们后来诊断她的血糖特低还是特高，不知道。然后也是通过饮食控制的，她说。
但是孩子健康吗？
Was the second pregnancy, was the child healthy when he was born? Healthy child when she was born?
Yeah, she was born.
Any
Yeah, she's my
problem?
only child.
Any problems or not?
Girl
Only
and boy.
problem, when I gave birth to her,
Nice.
when I
Is
gave
a girl
birth,
or a
they
boy?
said- A girl.
Girl. 她说健康的。
It's a girl.
Very
They said she has. The doctor said she has blood infection. She had to stay in the hospital for 10 days.
她说她
Because
出
she
生
had
的
the
时候，医
blood
生诊断出来她的血有感染，
infection.
必须住院10天，10天后才允许出院的。那个小孩啦，出生后，对。Was the second pregnancy C-section or natural delivery?
C-section.
C-section. 剖腹产。
第三胎。
You can carry on with the third pregnancy.
Third.
Okay, the third, I got pregnant 2019. It's just 8 months after the second. Another 8 months, I conceived again. It's my first time to have incompetent.
Sorry, your connection is a bit unstable. 是他的问题对吧？
这个是要装什么？
Internet.
没事，不是，就关了呢。关了。他卡了。Yeah, 好，继续。好了。Is your internet's a bit unstable? Is it everything okay?
Hello. There,
Hello.
I got back.
Yeah.
There. It's
The internet
because of
stable?
the internet.
The internet stable?
Yeah, it's okay now.
Okay. You were saying 2019?
Yeah, so during my third pregnancy, that was the first time I had a cervical. Was that IC, incompetence cervical.
第一次这个被诊断出来有宫颈机能不全，第三次妊娠。对。
多少周流产？就是29周流产。
等一等哈。The third pregnancy, when did you miscarry? Which week?
20th
week.
20
周。
刚才不是都怀孕到29周了吗？
第二次到37周，全程。
我说第三次不怀的，就2019。
2019对啊，他说20周流产。对。So your third pregnancy, right? To confirm again, maybe we didn't understand properly. Third pregnancy, you miscarried on the 20th week, right?
20. Yeah,
5 months.
20.
5 months, huh? 5 months.
Yeah, 5 months. Yeah.
5个月流产。问老院长有什么问题？ Anything else?
And then, but that time, it was 3.5 centimeter for the cervix.
他说公斤的长度是
was-
3.5cm， 3.5cm 那一年。This test,
When I
this
found-
3.5 cm was done after the miscarriage or before pregnancy?
No, while pregnant.
pregnant.
That's why they had to terminate it. Yeah, they said that
Someone-
the fit went out to the cervix.
他
That's
们说
what they
胎囊
said.
脱垂了，就是拖出去那个宫口，然后宫口开始看，对，所以才被他医生叫他终止妊娠的。对
第四次。
，OK， the fourth one，
And then for the fourth, which is the recent one,
最近的，他上个月才留的。Fourth one， yeah?
I
怀孕多少
sent you all the
Yeah, the reports, yeah, I understand. But
the
we just
test,
need the numbers.
but
For
I
example,
remember,
how
yeah,
many weeks
the-
pregnant? Was it also the same?
20 weeks also.
也是一样20周。
Yeah, 20 weeks also.
吐了吗？
Did you have the headache and vomiting as well?
第二次、第三次有 vomiting？
I did not eat a lot. I could not eat a lot. That's why
他
I
说
did
这
not
次吃不
vomit.
了太多东西，
啊？
他吃不了太多东西，
And I
这一次就是食欲不高，所以他没有吐太多。
明白。
But what about the vertigo? You said you had vertigo, right? Headache. What about that?
During the second pregnancy, I had vertigo.
This one? The recent one?
The fourth one,
Mm.
the third one and the fourth one, I don't have.
他说
I
第三、
did
第
not
四没那
have
么严重，
vertigo.
他的那个头晕还是啥的，他们没那么严重。
I see。好吧。
对
当地医生的诊断是
But
什么？
I lost weight a lot. Like
可是
a
他
lot.
他说，Oh, you mean this pregnancy?
Yeah, with the fourth and the third, I lose weight
他说
during
他第三、
my
第四的这个怀孕呢，他体重减了很多，怀孕的时候，正常是应该是增加对吧？可是他减了很多，瘦了很多。Dr. Chen will ask, what is your local doctor's diagnosis? You went to a lot of OBGYNs, right? What did they conclude?
Well, all
besides cervical
all they
insufficiency?
say is that I just have to try again next time, and then if next time the next time that I will get pregnant again, I have to put cerclage at the early stage. Wherein actually during my fourth, since I already found out during the third pregnancy, right? They told me that I have incontinence. So when it was my fourth time, I told them to have cerclage at 14 weeks. But then the doctor said that it's okay, we will see later on. But then after my vaccination, that night itself, the COVID vaccine, I got a body pain, and then what do you call that? I had the water leak. It got leaked. And then my cervix was 0.5. It opened 0.5. It's not even 1 centimeter. It's 0.5 only.
Understand.
But then my water bag, the amniotic bag, went out the cervix. So it prolapsed.
Happen again.
But then that's the time that I went back to the hospital to have it IV, the intravenous for the isosuprene. Is that isosuprene? Yeah. And then it went back the next 48 hours. The cervix went closed again. But then when I take a poo, when I take a bowel movement, the next 48 hours, the cervix went open again, and the more leak that it's leaking. The water is leaking. And then I told the doctor that I'm having like contraction. But then she did not check if it's real contraction. when I just found out that there's this what you call Braxton Hicks. So I just learned about that after I had that termination. So it was very late when I found the Braxton Hicks. And then the doctor terminated the baby. That's why I was telling it right now that it's not supposed to be terminated.
I understand.
In fact, I didn't have.
I understand, Nice. Hold on, let me just explain to Dr. Chen, okay?
Okay.
所以院长他说他这次怀孕因为第3次怀孕就已经诊断出来是子宫机能不全，然后医生说你下一次怀孕你就孕早期就来放一个 clutch， 就是宫口的那个骨放着，然后呢这一次她怀孕第4次嘛，她就要求可不可以跟那个医生说孕前放这个骨，然后医生说不用紧，你就怀孕先，我们怀孕了我们再放。然后她怀孕了14周，她就去找那个医生，可不可以放骨呢？然后医生说一切很正常，好像不用了，她就回家了。然后发现到接近20周的时候，她开始有不知道是胎水破了还是什么，可是有一些液体啦在露出来，然后她就着急了，她就去了医院。医院说那个宫口已经开了0.5 cm， 然后也发现这个胎囊也是脱垂了一点点，看得到了。然后他们也给他了一点药啊，然后一些 IV 啊，住院。然后他们也跟他确保就是一切很正常，没有问题了。然后隔天他上了厕所是吧？就上number 2 what to say pass motion how to say 就是大便不是大便。然后他说大便过后不知道是不是因为大便导致的，他也大便过了，那个胎囊脱垂更严重。然后医生说严重了，没有办法了，必须终止妊娠，然后就给他催产素，终止了他的妊娠。然后他又生气又伤心，因为他觉得好像是可以避免的，这个孩子不应该死的，所以就这样。
诊断没问题了，就是继发性的宫颈机能不全，宫口松弛，那个再加上妊娠剧吐了，这2个因素都与晚期流产有关。你可能就是因为妊娠剧吐反复吐的第2个孩子就把宫颈机能给吐的不全了，他反复加负压，所以那宫颈被刺激被扩张撕裂了，被扩张了。所以呢，我们医院是你在怀孕之前来打上这个妊娠剧吐的疫苗，在宫颈埋上箍，签上约，如果再流产退全款，就跟他说就行。另外一个呢，就是现在一定要避好孕，千万不能再怀孕了。再怀孕了以后，越次数多，宫口越松。
Okay, so what Dr. Chen says here that the problem seems to be very clear. So the doctor's diagnosis should be correct. So 1, you have cervical insufficiency. Secondly is you might have hyperemesis as well. So why you have cervical insufficiency, we believe is because of the hyperemesis, because of your abdomen's contraction, because of the vomiting, severe vomiting, right? It might have triggered the cervical insufficiency. So cervical insufficiency and this hyperemesis are known as the common causes for late miscarriage. And yours is clearly a late miscarriage because they're happening consistently on the 20th week, 19th week, right? 5-month period. So here at our hospital, right? Our treatment is, right? We will treat your hyperemesis by giving you injections. The treatment is via injection. All treatment is done before pregnancy. So that we can make sure the whole journey is smooth. You won't have any protruding, no leaking, no any complications because that's how we do things here. We do it before pregnancy. So injections for the hyperemesis, and then the cervical circlage. Our circlage is not stitching. We just put it on the cervical neck. And then we can make sure that you have a full full-term successful pregnancy. So at this point, right, you should not be trying to conceive again. You should be on contraceptives. Don't get pregnant at this point until you receive treatment, because most likely it will miscarry again.
Oh.
So again,
Yeah,
I like
yeah.
to mention, right, our hospital, we offer full refund guarantee if you see a miscarriage again after receiving our treatment.
Yeah. I just have a question. Like if my hyperemesis was diagnosed and get treated, will my pregnancy be normal? Like, can I do my work? I mean, can I be like a normal pregnant that, isn't it other pregnants can still walk, can still do the household chores? Sometimes they even work at the office.
Correct.
它转过来，把图像转过来。
Nice. Your
advise
camera
me
is
not
upside down. Your camera is upside down.
I don't
Do
know
you
how
see
to.
it?
Upside down niya, ano?
Again upside down.
Okay, I will.
Okay, now great.
Yeah.
Because we couldn't see you properly. All right. All
I
right.
am
Thank you.
required to bed rest.
Do I still require to bed rest? Because I asked the doctor here if I would get a what do you call this, a pessary or cerclage on my next pregnancy. I asked them, like, will I still have contractions?
And
They said yes.
so you are
But
asking whether or not you
I'm-
will be bed rest for like a long time after treatment. Is that your question?
Yeah.
他问
Yeah,
他的问
because
题是
isn't
我们
it
的治疗过后
video? Bed rest is
是
not
需要
the
卧床休
real
息，
answer
长期
for
卧床休息。
the diagnosis, right?
因为他的医生都是要求，就是 cerclage 后你必须躺在家里，不能动。因为他是需要工作。
不许你，
我可以回答，我可以回
你
答。
必须正常的工作，必须正常的生活，否则我们还不给你治呢。
对 ，So Dr. Chen says here, right, that you must actually carry out your daily activities. We want you to walk around, run around, do your activities, sweep the floor. If you want to do any sports, light activities, go to work, no problem. This is actually recommended. Yeah. Because bed rest is actually not good for the pregnancy. Can even cause worse problems.
Cause more problems.
Mm.
And what about the other underlying conditions? Will it be treated? Like for example, any other conditions that I don't know, but of course, what I know right now is my family history, right? Which I mentioned a while ago. I mean before, my mom aneurysm,
embolism.
thyroid, and, embolism, because those are my parents' reason why when they died. So it's connected somehow with the.
We don't believe it's connected because aneurysm, embolism. 院长他问，因为他有个家室啦，他的父母都有一些遗传病，不知道是不是遗传病。院长，悬塞你知道是什么病吗？
什么？
悬塞。栓塞啊，知道吗？他的父亲是因为栓塞这个病去世的，然后他的母亲是另外一个病，那个动脉瘤，
没关系，
然后都是比较，aneurysm and embolism is not affecting your pregnancy. Don't worry, because they are not actually genetic conditions. Yeah, aneurysm is mostly a random one, a random clinical condition. As for your thyroid condition, 他说他的甲状腺也是有一些问题，是不是一个因素？
Yeah, because since my grandmother, my aunties, my mother, they have thyroid. Also, when I was 16 years old, I think I have a thyroid. I just
他现在
forgot
的问
if
题
it's
只能引起早期流产，不能引起晚期流产。
他说他全家都有这个甲状腺的问题，甲状腺功能的一些问题。So Dr. Chen says, right, if the thyroid actually is affecting your pregnancy, right, you will have miscarried in the first trimester, but you are miscarrying in the 28th week. So clearly, the thyroid is not affecting your pregnancy.
Oh.
If thyroid is a factor, you will miscarry within 12 weeks.
What about the gestational diabetes? Will I still be getting that again and again?
他说这个妊娠糖尿病呢，是不是下一次又会回来呢？还是跟那个妊娠剧吐？
那有可能。
Yes, very
妊娠剧吐没有了。
We can make sure that the hyperemesis won't come back, but for your gestational diabetes, right? Yeah, it is a possibility that you might have it again during your next pregnancy.
Okay.
But it's definitely manageable.
So what are the tests that we should be needing for those, for the diagnosis, for the like the next step that we should be doing?
I mean, next step you should come to a hospital as soon as possible, because, for example, right, hyperemesis, right, it's not a treatment that is available in all hospitals. Our hyperemesis treatment is actually our own invention, our own discovery.
Yeah.
And
I've read the patent.
It's not available in other hospitals, so we can't really recommend you to go to which institution for what diagnosis and checkup. We should only recommend that you should come immediately if you want to conceive within a few months, next year or something.
While treating the hyperemesis, how do you do that? How's the process? Like, do I get that for one injection only, or how long will it be for the process? For the treatment?
So the hyperemesis treatment, right? Hyperemesis treatment, right, is you will only need to be in the hospital for a few days, and we will administer you injections, few injections depending on how you react. Just injections, yeah. And then you can bring the medication back back home as well, where you can administer on yourself. But the course of treatment is before treatment, one course of treatment, usually 4 injections. 4, not more than 4, because some people 1 or 2, but usually 4 is the standard. And then after you get pregnant, successfully get pregnant, and then another 4. That's it.
So if my hyperemesis was treated, and then when I get pregnant, should I be needing the preventive cerclage?
Yes, of course. You still need the preventive cerclage. Correct, because they are 2 separate conditions. You have 2 conditions.
Okay.
Yeah, independent. Correct. Hyperemesis and then the late miscarriage, cervical insufficiency. So all treatment is done before pregnancy.
Even the
to a hospital, right? Even the cerclage.
Oh, like if I'm not pregnant, should I be getting the cerclage?
他说，如果假设他不怀孕，他可以买股吗？
对呀，只能是不怀孕，
这是最好的。
Only 吧。
So this is the best method, actually, the best way, the most effective way is to have it done before pregnancy. Plus, it won't affect your conceiving process.
Oh, yeah,
because
that's what I'm thinking.
Because having surgery during pregnancy is much riskier, right? So you want to have it done before. So if you do it before, right, there's almost no chance for it to happen, any complication. 什么是哪种？
妊娠剧吐和宫颈松弛都在孕前治疗，孕后 no， 孕后没有治疗。告诉他，孕后没有任何治疗。
Dr. Chen wants to emphasize that treatment after pregnancy is we don't really do that because it's quite risky. It's not allowed.
So we do all the treatment before
we do all the treatment
getting
before
pregnant.
pregnancy. Yeah, we don't do treatment after pregnancy.
Oh yeah, so even cerclage.
Yeah, even
like should I
cerclage.
get cerclage before I get pregnant?
Correct. Yes, all before pregnancy.
Oh, yeah, because even in other hospital, even in other country, what I've read is that they put the cerclage when it's pregnant, which is I'm
Correct.
also thinking,
So
why,
some
why
hospitals
is it
do things differently. Our hospital, we do it before
pareho lang
pregnant.
yung katwa talaga.
Correct.
Should I
Because it will
get
cause some problems
pregnant
and risks.
easily if I have cerclage?
Yeah, it won't affect.
Guys,
It won't affect. It won't affect your pregnancy.
but
The
isn't it the
conceiving
cerclage
process.
that you'll be doing is not stitch, right?
There's no stitch. No stitch.
Yeah, because in here it's a stitch.
Correct.
There are two types. It's the pessary, it's like the ring, and then it's a cerclage that is a stitch.
Correct. So
That's-
ours is not a stitch. Ours is just secured on your cervical neck. Correct.
So when, like, for example, I just had it terminated pregnancy of 10 days ago or less.
10 days ago.
How many days was it? 12 days ago. Yeah,
12
I think
days ago,
12 days
okay.
ago. So when is the best time? Like when is the best time to have myself get treated? Like is it
他说他
after 3
12天
months?
前才进行了人流，他什么时候应该过来治疗呢？他10天左右刚人流，就是第4胎。他什么
下次月经干净就
下
可以
次月经干净。So Dr. Chen says the best you can come for treatment for your after your next menses is cleared up. Your next period.
anytime.
Okay. So anytime, okay.
Yeah, anytime.
Okay, at
Yeah.
least I know. And then, okay. Naano pa ba yung kutang ko? I'm still
You have any
thinking
more
of my
questions?
question.
Yeah, okay.
Ikatingkan po rin ko tangking kaya ka. Thank you ka.
行，有事再微信聊吧，再套。
Okay.
套
So
口吧
Nazer, if you have any other
will it
questions, you can just text us. Otherwise, because we have another
Yeah,
consultation.
So is it only in China or what about in Singapore? Is it available also in Singapore? Because I'm thinking if it will not
for now,
be available in I will not be available in China, I might be available in Singapore. Anyway, those two countries doesn't need visa, but the
correct.
COVID thingy right now is
I understand, but surgery can only be done in Beijing right now, because all the best
In China.
doctors and all the hospitals all in Beijing right now. So you want the best treatment, you have to go to Beijing. Singapore is only a research base, a marketing base.
And then how much will it cost?
多少钱呢？这两个病治疗
For everything, like so that I will
15万人民币
prepare my
15美金可以吗？
3万新币没用，你得说就说美元吧，他不懂这个。
even the check-up, even the test,
Yeah.
everything. Like so that I would
15万是吧
prepare.
Roughly around 23K USD, 24K USD. Will cover the whole thing
23K
because
USD.
you have covers your hospitalization, all the diagnostics tests, surgery, and all fees 啦。24万元啦
Okay.
24000美金，15万人民币是24000美金。Because you have two conditions. It depends on how many conditions. Yeah. And if you sign a contract with us, right? If you pay the money, go for the treatment, and if you still miscarry, right? We will offer full refund. But it is not likely because we can guarantee success.
Sige. I will check how much is everything, even my accommodation, etc.
No,
And then I will
accommodation is in the
prepare-
hospital. Accommodation is in the
is that-
hospital, correct? 对，他可以直接住在医院，对吧？
对，
直接住在医院。Yeah, you can stay in the hospital. Even your family members. We have a suite.
1 week in my
How many
husband,
days will it be?
1 week.
1 week. You just need to be here for 1 week. Are you
Okay.
cool?
So even the test, hospital. Does the hospital except for the international, what do you call this?
Insurance.
Insurance.
Okay, yes, sure. As long as international coverage, we can cover it. You just need to make sure your health insurance is international.
Yeah. I will ask my agent for the insurance and check about the thing and get prepared.
So if you do get ready, right? You should come as soon as possible if you want to get pregnant within the next 6 months. Yeah, earlier the better.
Yeah, I think it will be in the next 6 months.
You need some time to recover as well.
Yeah. Plus our business is season during January to June. So probably after June will be my most vacant time to go there for the trip. Or maybe maybe earlier than June.
Maybe earlier than
June.
Understood.
And I will have to check the insurance, my insurance policy.
Sure. So
and then what about the test?
What?
So do I get test prior, like while I still here and then bring my test there, or
no,
or it will
test.
be done everything there?
Yeah, everything is covered in the hospital. Yeah, don't need to do any prior test. 他说他来之前需要做什么测试吗？什么孕前检查还是什么？对，不用 ，just come.
What if I get a room that is the basic room for the hospital? Will the price get lower?
There's only one time. There's only one standard patient suite that we offer. Yeah.
Okay.
Like a family
So
suite where you can have your family members and stuff.
Oh, really? Oh, okay. Good. Anyway, we are planning to go to Beijing anyway. So we will plan when my family will be there also.
Sure.
Because 2021, we are really be going there. Anyway, thank you so much for all the information. I would really want to take it.
Understand. We are happy to help you. And we also want to help you. So if you come, we can have you treated, then you can also have a successful pregnancy. Yeah, the fifth one will be successful.
Yeah, my sister's asking if you PCOS.
What question? I cannot hear, sorry.
My sister's asking if you are also treating PCOS.
Oh, PCOS.
Yeah, PCOS.
Yeah, PCOS, yes, we also treat. She can come together with you if she wants to get treatment together.
Yeah, actually, I'm telling her about this too, so that when we go there in China, it will be us together. How will be the treatment for the PCOS? PCOS.
PCOS is
it also like?
No. For her, she needs to do surgery. We will do surgery.
Surgery. Okay.
All right. Yeah, but also both of you need to be in the hospital for just 1 week. That's all.
Yeah, that's why. That's what.
Yeah, so you guys can find 1 week to come to Beijing.
Yes. I just after my business season, because the business season here is January to March. But anyway, we are really looking forward to go there and finally get treated.
Okay.
I'm glad to see. I'm glad that I've seen your advertisements in YouTube, and it's really a big help because it's my condition that I'm experiencing, that here in the Philippines and even some other countries cannot explain what was it. Like,
correct. I mean,
I don't know, they
really
cannot answer.
Yeah, mostly because they don't specialize in it. That's why.
Yeah, and like what I told you, my uncle is also an OB and even own an hospital here. But then all they say is better luck next time and do the preventive.
Yeah, so clearly,
next
if they say something like that, clearly they don't specialize. They are not specialists in this type of field.
How about my thyroid? Should I get? Do I need to treat my thyroid first before I get treated for the hyperemesis?
No need. You have no need to do any tests. no treatment. Just get yourself to Beijing. That's the most important thing. Because we are a maternity hospital, we will take care of everything.
Okay. Thank you so much.
All right. So if you have any questions, we can just connect on the WhatsApp.
Sure. I'll just leave a message on the WhatsApp.
Sure.
Thank you so much. Thank you for the time. Thank you also for.
See you in Beijing. Yeah.
Thank you so much.
See you in Beijing.